This is a very special time. We actually have another moment in history where we can make some real reform come true. So we should take advantage of it, because there's not going to be another time like this one, and there's not going to be another group of people like this one. We are the ones we've been waiting for, so now that we're all here, let's get it did. And now I'd like to introduce a gentleman that really doesn't need any introduction at all. He and Quentin Young, Dr. Young, have been friends for a long time and collaborated many times on health and medicine, on issues. He has worked to try to move healthcare forward in the state of Illinois. Ladies and gentlemen, help me welcome to this stage the Governor of the state of Illinois, Mr. Patrick Quinn.
Good. Thank you. There's Quentin over there. Well, I have known Quentin a long time. I was one of his patients, although every time I went down there to that Hyde Park office of his, he wanted to talk more about politics than medicine. But I'm sure that's true of most everybody in this room. And Quentin and I actually walked across Illinois in 2001 for decent health care. Before we walked there, we wanted to take a couple of pictures. And so we went over to the Abraham Lincoln statue, and it's one actually in Grant Park, right near Lake Michigan. And then Quentin, when we got to the statue, said he knew Abraham Lincoln when he was growing up. And he looked a little like him there, and he got a lot of inspiration during our walk. We began at the Centennial Bridge in Rock Island, right over the Mississippi River. We have 583 miles of the Mississippi River as the border of Illinois. And Mark Twain once said, I was told by Quentin, whiskey's for drinking and water's worth fighting for. So we didn't drink any whiskey that day, but we started on a very hot August day. Every day it was over 90 degrees. And we walked and we walked. Sometimes there was a temptation on the part of Dr. Young to try and go a little bit ahead of where we ended up the day before, but as the former Secretary-Treasurer of the Coalition for Political Honesty, I wouldn't let him do that. And we were also helped along the way by our beloved person that we never will forget, and that's Ruth Young, who kept us all online. You know, Ruth was there, and Quentin, as he was talking about everything under the sun, I was told later by WBEZ that they limited him to one aphorism a day from Quentin Young. But unfortunately, I didn't know about that, so for 15 days, I heard every aphorism every day. And as Quentin was carrying on and we were listening intently, his wife had to tell him, get out of the middle of the road, Quentin. There's big trucks coming. And as you know, he's always been a middle-of-the-road kind of guy. He really hasn't been to the left side of the plate. But we went over and over again, day after day, on behalf of decent health care. I remember we were walking one day on a Saturday. It was pouring rain. It was just pouring rain, sideways. The two of us were along the side of the road there, and this Mennonite couple came up, and they were in a car, and they said, would you like a lift? And we said, no, we're doing this on purpose. We want to walk every step of the way to talk to people along the way about decent health care in Illinois and in the United States. I know when we got to Mendota, that was halfway point. It was like going to the land of Oz, because we got to stay in one of Quentin's favorite places. I had a VIP card at, I'm digging it out here, at Super 8, and so we were able to stay there. We had a tough time the next morning because I said, let's go to McDonald's for breakfast. And Quentin said, they serve breakfast there? You know, he hadn't been, I think, to too many McDonald's in Hyde Park. But we covered a long trek, met a lot of different people. I think Quentin was able, in the best English possible, he has the best vocabulary of any human being I've ever met. I'm not sure what soporific or whatever that word was earlier means, but he was able in plain language to express to all kinds of people, large and small, what the importance is of decent health care for everybody. Everybody in, nobody left out. And, and we did stop along the way for some treats. Quentin said you can eat anything you want. You know, anything you want. Just you're going to lose 15 pounds if you walk across Illinois in 90-degree heat in August. That's the Quentin Young diet for losing weight. But when we came to Dairy Queen, he started calling it Dairy Quinn because I didn't want to pass up that wonderful opportunity. I've never... Now, having said all this, Dr. Young, as you know, was a veteran. He served in World War II. He was a very, I think, important person, making sure that we had decent health care for our troops and all of those that they served. And Quentin and I, not that long ago, a year or two ago, went to Landstuhl Army Medical Center in Landstuhl, Germany. It's the premier trauma center in the world where our soldiers from Iraq and Afghanistan are evacuated to, and we were able to visit the staff there and the patients, and he did a wonderful job, I think, in expressing the really the importance of all Americans supporting our doctors and nurses and physical therapists, and most importantly our soldiers who in many cases are horribly maimed and burned. Dr. Young brought his brand of medicine to our men and women in uniform. We thank him for that, very much so. And at that time, I was Lieutenant Governor of Illinois, and I don't think I got the kind of respect from Quentin that I deserve. So now today, through dint of circumstance, an accident of history, we now have an accidental governor, then that's one of your former patients. I'm not sure if you had a governor as a former patient. He's had a U.S. senator, president, but now you got a governor, Quentin, whether you like it or not. And as my closing remark, we're going to turn the tables on Quentin. He's always asking us to do things, but on behalf of the people of Illinois, we're asking Dr. Young, Quentin Young, I think it's Quentin D. Young, if I'm not mistaken, to be a $1 a year advisor to the governor of Illinois on health care. So we're going to put you on the payroll, Quentin. You've always been one of those guys who likes to be on a public payroll. So ever since you left Cook County Hospital, I know that's been a desire of yours. So we'll have Dr. Young's unsolicited advice on a variety of different subjects. Danny Davis, our great congressman, is here. Jan Chakowski is here. John Conyers is here. Mary Flowers is here. Julie Hamos is here. So all of us public officials, we need another comrade in arms. That's Quentin D. Young. Dr. Young, may the will of people be the law of the land. Thank you very much.